This again is a de-identified case, but the history remains pretty accurate. So Zhang Wei is a 76-year-old fellow. He has a history of multiple psychiatric inpatient admissions over about 20 years, including a suicide attempt in the previous 2 years. When we actually went out and conducted his eligibility assessment, we found that there were multiple psychiatric comorbidities that included, but weren't limited to, I should emphasise, somatisation disorder, a tendency to develop physical symptoms that have no basis in actual pathology, conversion disorder, which is where symptoms are produced purely through psychological mechanisms, and the conversion disorder was felt to affect cognitive symptoms as well in Zhang Wei's case. Histrionic personality disorder, a particular type of personality disorder where behaviour can be problematic in and of itself and quite dramatic. Depression with OCD symptoms, obsessive-compulsive symptoms, and also a past history of psychosis and anxiety. So a full hand of psychiatric diagnoses, plus, within the last 2 years, a relatively recent diagnosis of frontotemporal dementia, which was made in an inpatient-aged psychiatry setting, but was clouded when they sought a second diagnostic opinion on these symptoms. And the second opinion was that this was a conversion disorder presenting with cognitive symptoms, so not actually a dementia. So this is a fellow with a particularly complex psychiatric background, a diagnosis of dementia that was made by a specialist but was disputed by a second specialist. And in particular with Zhang Wei's behaviours, it was noted that the behaviours only really became problematic after he had a period in intensive care with a respiratory infection, and a period of being sedated and intubated. When he came out of ICU, the behaviours were much more amplified. So we had a number of doubts in relation to Zhang Wei's eligibility. The first doubt being that those multiple behaviours that had been long-standing seemed to be better explained by his psychiatric comorbidities than by any more recent diagnosis of dementia. The diagnosis of dementia itself was cast into doubt by being put forward possibly as a conversion disorder, so not a dementia at all. And in that case, those behaviours, again, aren't going to settle down in 12 months, so not eligible for the program on that basis. The fact that the behaviours worsened significantly following the ICU admission suggested that there might have been a component of acquired brain injury and hypoxia in there as well. At the point at which Zhang Wei was referred, there had been no specialist involvement short of his current aged persons mental health inpatient admission. So SBRT hadn't had an attempt to manage these services, though he had been an inpatient in older adult mental health for some time. But we felt in his case that the behaviours weren't primarily related to the dementia, if indeed a dementia existed, so that itself was in doubt. Certainly the behaviours were severe to very severe, but they took the form of behaviours that were consistent with his previous psychiatric diagnoses, and they were certainly intractable to adequate trials of inpatient management, but there'd been no specialist care or attempts to provide that in a nursing home setting previously. So for a number of reasons, we decided against approving Zhang Wei's eligibility. Certainly the behaviours were intractable, but we felt that they didn't primarily arise as a result of dementia, despite the behaviours themselves being particularly severe.